Welcome to this resource on Cushing's and Addison's. We will cover some key points and have some practice questions at the end that might cover material you might see on your exam. But first, let me welcome you to Artemis Interactive Media. Artemis is your guide to learning resource supplements and content overview for continuing education. This quick timeout is a short study break. It will cover Cushing's and Addison's, hypersecretion and hyposecretion of the adrenal cortex. If we need any help during the practice questions at the end, Artemis will be here to guide us. Let's start with some anatomy and physiology. We have two kidneys, and on each kidney, we have an adrenal gland. These two adrenal glands have two parts, the adrenal cortex, which is like the outside shell, and the adrenal medulla, which is the inside or the middle. The adrenal medulla is like the middle, and it's going to secrete epinephrine and norepinephrine. If you'd like more information on that, you can review resource covering the autonomic nervous system and pheochromocytoma. This resource will cover a few disorders of the adrenal cortex. The adrenal cortex, I think of it like the outside coating. It's going to secrete glucocorticoids, mineralocorticoids, and androgens. The glucocorticoids, well, that sounds like glucose or sugar. So for this resource, we're going to call it sugar. The mineralocorticoid is actually aldosterone. Aldosterone tells your body hold sodium in water. So for this resource, we're going to call it salt. It's not really salt, but the more mineralocorticoid aldosterone you have, the more sodium you have. The more sodium you have, these are the effects you're going to see. So for this resource, we're going to say sugar, salt, and then the last one is going to be androgen. Those are sex hormones. So sugar, salt, sex. Again, the mineralocorticoid is not actually salt, it's aldosterone, but the more aldosterone you have, the more sodium you have. For our QT, mineralocorticoid refers to aldosterone. Aldosterone tells your body to hold sodium in water. The more aldosterone you have, the more sodium you have. Let's start with hypersecretion of the adrenal cortex. It secretes sugar, salt, sex. Well, if you have hypersecretion, you're going to have too much of that. Too much sugar, what would happen to the blood glucose level? It will go up. If you have too much salt, what would happen to the sodium level? It will go up as well. If you have too much sex hormones, you might have hirsutism, masculine characteristics. If you're a female, you might have hair on your face. What would happen to the blood pressure if we have too much sodium? It's going to go up. What would happen to their weight if they're holding on to too much sodium and too much glucocorticoids, which we're calling sugar? It would go up as well. If our client has hypersecretion of the adrenal cortex, which is sugar, salt, sex, what labs should we monitor? Let's consider glucose because they're holding glucocorticoids, sodium, and I would add potassium because there's often an inversely proportionate relationship between sodium and potassium. Those would go up, the glucose and the sodium, where the potassium might be decreased. An appropriate diet would be low sodium, low concentrated sweets. Some of the physical characteristics we might see for a patient with hypersecretion of the adrenal cortex include maybe a rounded face, a moon face, hirsutism, which might be hair on the face, masculine characteristics. You might see we're calling it a buffalo hump, but it's the fat pad on the upper back. They might have truncal obesity, striae, and thinner arms and legs. With hyposecretion of the adrenal cortex, they don't make enough glucocorticoids, mineralocorticoid aldosterone, and sex hormones. What would happen to the blood glucose level? It would be decreased. What happens to the sodium level? It would be decreased. And you might see bronzy pigmentation. What would happen to the blood pressure if they're not holding enough sodium? It's going to decrease. What would happen to their weight if they're not holding enough glucocorticoids or sodium? It would decrease as well. For the hormones produced by somebody with Addison's or Cushing's, we would consider the glucocorticoids, which we're calling sugar, the mineralocorticoid aldosterone, which we're referring to here as salt, and androgens, which are sex hormones. We're going to monitor their weight, monitor blood pressure, and we're also going to monitor the white blood cell count for both patients because with Addison's, they don't make enough glucocorticoids. I think of it like you have to add some for Addison's. They don't make enough glucocorticoids, so it's very difficult for them to fight infection. With Cushing, they make a lot of stress hormones, cortisol, and that does affect their immune system, so they're also at risk for infection. I think you get cushy with Cushing's, you better add some for Addison's. So remember, monitor blood pressure, and protect the client from infection. Addison's and Cushing's can be complicated topics to understand. They affect more than one body system and require different treatment considerations. The following questions will test our knowledge on the material we covered in this resource. Please answer the following 5 questions to gauge our mastery of this material, and don't worry, if we need help, Artemis will be here to guide us. Question 1. A nurse is assessing a client with Cushing syndrome. Which findings should the nurse expect? A. Weight loss. B. Hypoglycemia. C. Moon face and truncal obesity. D. Hyperpigmentation. Artemis, can you help us out? The answer is going to be C. Moon face and truncal obesity. And that makes sense because with Cushing, they hold too much glucocorticoid, mineralocorticoid, and sex hormones, whereas you would have the moon face and the truncal obesity. Thanks, Artemis. The rationale for this is Cushing syndrome is caused by excess cortisol leading to fat redistribution, moon face, buffalo hump, and truncal obesity, hyperglycemia, and muscle wasting. Question 2. A client with Addison's disease is at risk for which electrolyte imbalance? A. Hypernatremia and hypokalemia, hypophosphatemia and hypernatremia, hypocalcemia and hypomagnesemia, hyponatremia and hyperkalemia. Artemis, can you help us out? And the answer is going to be D, hyponatremia and hyperkalemia. Artemis, give us some rationale, please. Addison's disease causes decreased aldosterone, resulting in sodium loss and potassium retention. Thanks, Artemis. Question 3. Which statement by a client with Addison's disease indicates understanding of discharge teaching? A. I can stop my steroids when I feel better. B. I should increase my medication during time of stress. C. I should avoid wearing a medical alert bracelet. Or D. I do not need extra fluids when ill. Artemis, help us out, please. B. I should increase my medication during times of stress. Can you give us some rationale? Artemis says stress increases the body's need for cortisol. Clients may require increased glucocorticoid during illness, surgery, or trauma. Thanks, Artemis. Question 4. A client with Cushing syndrome is most at risk for which of the following complications? A. Hypotension, B. Dehydration, C. Infection, or D. Weight loss. I'm going to say C. Infection. Artemis, can you tell me if I'm right, please? And Artemis says, yes, it's infection. Can you give me rationale? Excess cortisol suppresses the immune system, increasing the risk for infection and delayed wound healing. Question 5. A nurse suspects Addisonian crisis in a client. Which assessment finding requires immediate action? A. A blood pressure of 78/42. B. Weight gain of 2 pounds. C. Blood glucose of 128. Or mild anxiety. I'm going to say A. Blood pressure of 78/42. And Artemis says we're right. Can you give us some rationale? Addisonian crisis is life-threatening and causes severe hypotension, shock, dehydration, and hypoglycemia. Immediate IV fluids and corticosteroids are required. Thanks, Artemis. Thank you for your attention to this resource provided by Artemis Interactive Media. This presentation may be used for content review and clinical competency for pre-conference and post-conference education. This quick timeout can also be used for a short study break. Cushing's and Addison's involve more than this QT covers. For more information on these disorders, please contact your instructor and refer to your textbook.